Well, this image is one of Center for Hope's most powerful displays. Each year, LifeBridge Health places red desks outside of Sinai Hospital representing murdered children in Baltimore City. But every day, the organization works to fight against the tide of violence here in the city, from domestic abuse to community violence. Now, this mission faces a new hurdle, and that's cuts in federal funding. Joining us now from the Center for Hope is Adam Rosenberg. Good to see you.
Good to see you, Jason. Good morning. How are you?
I'm doing well. And before we get to the federal cuts, there's some folks who know your name but don't know the mission. Tell us a little bit about what the center does.
Center for Hope is a first of its kind program in the country where a health system has taken on the various plagues that occur in society: child abuse, domestic violence, gun violence, and we're all working to make sure that we keep the community safe and healthy and out of the emergency room. And so Center for Hope is the distillation of many programs that we've been running for a long time. The former Baltimore Child Abuse Center, our domestic violence programs at Grace Medical and Northwest Hospital. We're managing 6 Safe Street sites. We've got a medical program, we've got mental health services, and we're providing 24/7 crisis response when people come in and they've been hurt. The central focus of a lot of our work for our 40-plus year history of all of our organizations has been about protecting children and defending childhood. And it grows at each iteration, that when we know we can do something better for that kid who's been a victim of child abuse, or that child who's in foster care, or that kid who's been abandoned, or that child who's witnessed domestic violence, and now that kid who's experienced and witnessed gun violence. All these children should get the best help possible, and we need to do everything we can to be able to not just help that child find some justice, but really give them the healing and the help that their family unit need to grow up into healthy kids.
There has to be an element of trust, I'm guessing. As you rattle off things that happen, I guess it has to take a willing participant to say, hey, we need you guys.
We build that, and on two sides, by the way. I think there's an element of trust that we build with our city, our city partners in law enforcement and prosecution and social services, our community partners who make referrals to us, youth-serving organizations who rely on us to help teach them ways to keep kids safe there, and then obviously our families, and I think that's the center of it. We really want to keep that family unit, that child, at the center of what we do, and provide them with the needs and the resources possible, whether it's a therapist, whether it's a ride to an appointment, whether it's rental assistance, whether it's our comfort dog Manny, who turns 10 next week.
Holy cow, really?
To be able to give them that supportive love to help them get to that next step there, and our team's there to move them along the way. And that's why it's about hope, and we love the name Hope, because it's not just about wish fulfillment, but a set of circumstances and plans in place to be able to help people grow and succeed.
It seems like it takes a variety. It's not a one-size-fits-all, because every issue has something different you have to approach.
And that was the big part when we built this program together, is I think a lot of victims violence services is very siloed. That the domestic violence community, the trafficking community, the child abuse community, and we recognized when we looked at our data that there were kids who had been victims of multiple forms of violence, or victims of violence, and then living in violent communities that needed that poly-victimization care. And so rather than send them to the next stop and the next stop and the next stop, if they come into our center, and please come by and see it, that we want to give them all the help that they can get there.
So just because the child may not be the victim of a crime or directly the person who may have caused their living situation, the trauma is still just as hard.
Yeah, there's an incredible body of work called the Adverse Childhood Experiences Study that indicates that when children have been victims of violence themselves, or witness to violence, or living with violence, or living with mental illness, or living with substance abuse, that impacts their psyche, the way they grow up. They manifest it inside there, they internalize it, and it turns into poor health outcomes later in life. And that when we don't intercede well with those childhood experiences that are adverse, it turns into heart disease and cancer and future forms of violence. And that's really one of the reasons that we built this program within LifeBridge Health, is where our goal is to keep you healthy in the community. That's our whole mission about Care Bravely. And so let's do what we can do to prevent the flow of people going into the emergency room and keep people at their homes being great kids.
Are there any fears when it comes to budget cuts as we look at the federal budget sort of take shape? And if so, how do you streamline? Are you still making impact if that happens?
No, we're making real cuts right now, and some difficult decisions have been made in the last few days. There's just less money out there. It hurt. us and other 300 other organizations around the country that have been working to combat violence when the Department of Justice abruptly canceled and terminated our grants that we had to improve community violence programs. For us, that's a $1.2 million cut.
Oof.
Yeah, and so fortunately with LifeBridge Health, we've got resources to be able to sustain the program for a little while.
Okay.
I have colleagues who had to lay off people immediately like that there when they had those cuts. And so we're looking to figure out what our solutions are, what programs are available, what cuts we need to make, because we want to sustain this work and keep it going. Look, Baltimore is in the moment of leading the nation in drops in homicide. We've got the lowest numbers we've ever seen in the city since before I was born in 1970.
Sure.
April had the lowest number of homicides recorded ever on record in the city. We've seen a 50% drop in gunshot wound admissions at Sinai Hospital. The work that we and our collaboration in the city is doing is making a real difference. Lives are being saved, communities are improving, but we're going to need funding to be able to sustain and continue that there. And look, here's the shameless plug on the Sunday morning. If there's someone out there who wants to help, I mean, get in touch with us. Visit lifebridgehealth.org/hope, make a donation, give us a call at 410-601-HOPE. It's going to take all of us to sustain this momentum and keep us going, to keep us all safe.
Appreciate the work you do, Adam.
Hey, thanks, Jason.
Yep, thank you for coming by.